Welcome to episode 5 of the Wiener Dog Lover podcast. Today's episode features Ericka McElwey from Change Your Range. Do you have a dachshund and have questions on topics like training and nutrition? Do you want a dachshund and need help finding a good breeder or locating a great rescue? Did you have a dachshund growing up and want to share some heartwarming or funny stories? Then you're in the right place. I'm your host, Lori LeDuc. Welcome to the Wiener Dog Lover podcast, the place to be for all things dachshund. Thank you for joining us, Wiener Dog Lovers. I hope this week is going well for both you and your dachshund. I want to thank everyone that's been listening to the podcast. I'm loving getting your feedback, and I'm really enjoying sharing the knowledge and experience of my guests with all of you. If you are enjoying it as well, I'd love for you to head on over to Apple Podcast or wherever you listen and post a review or share an episode with a friend. My goal is to help create a long and lasting relationship between you and your dachshund, so let's pass it on. Today's episode, I'm speaking with Ericka McElwey. Ericka has over 17 years of working in animal rehab. She is trained in Canine Trigger Point Myotherapy. She gained valuable experience working with vets in a state-of-the-art rehab facility. And later, Ericka developed her own protocols for strengthening and rehabbing pets and opened her own facility called Change Your Range. Leslie from Eddie's Wheels connected me with Ericka. Our conversation is really interesting, and I'm sure you'll listen to it a few times to get all the valuable information that she has to share. Ericka shares a couple of great exercises to do with your dachsie at home to help develop their core muscles, to help keep them strong and healthy and walking on all fours. If your dachsie is in a cart, Ericka also has some valuable tips for you. Ericka, thank you so much for joining us here today. Can you maybe just give us a little bit of your progression into the world of canine rehab and massage?
Yes. I am, well versed in the field now. I've been involved since 1999. I was certified in Trigger Point Myotherapy. That was my background in the rehab, starting my rehab career. And basically a friend of mine's dog was hit by a car, and he really, did not want to thrive. I had to have multiple surgeries and a whole rear hind end construction. And knowing about 20 years ago, what we're doing today was nowhere near as, well formed then. So he was in a lot of pain, and I was introduced to a therapist who was able to help him overcome that. And he was able to continue to live out the rest of his 10 years of life much more comfortably. And so that's what started me and kind of got my career going. And I've never let it go. I definitely am one of those people that once I started, it became who I am. I found myself, and it's just continued to evolve from there. And that's how Change Your Range began.
Awesome. I'm a dachsie mom, and this is the Wiener Dog Lover podcast. I've been pretty lucky at this point to have really healthy dachsies with very few, if any, back issues. What would you recommend to someone who maybe has a little dachshund or is getting a dachshund that's maybe getting up there in age but is in reasonably good health? What kind of exercise regimen might you suggest that can help keep them really strong and healthy?
I kind of have to go back a little bit because you state, what kind of things can we look out for if they are healthy and they're getting up in age. And I really want to go back to say congratulations that you've never had a dachshund have a back issue, because that means what you are doing is going well for you and your crew and your pack. But one of the things is getting a dachshund as a puppy and realizing how short their legs are and how, little their bodies are and how long their backs are, but yet how short their legs are. Really, when we say no stair climbing, no jumping off things, onto things, that's very important when they're really young. As well as, any dog that you've then adopted into a middle-aged life that you want to live into the happy, healthier years, really omitting full depth of stair climbing is important, because their hips and their leg length are not designed to go up the depth of stair that we're meant to go up and down. And what happens is there's just a lot of weight that gets, extra force that gets put into the mid part of their back. And so, we might have a couple stairs in and out of the house every now and then. That's not really the problem. It's really the flight of stairs, living on a second floor, that kind of thing. And it's going to, really be that, you need to carry them up and down and make this a part of understanding that's going to make a healthier lifestyle for them down the road. So when you think about their long backs, a lot of things I go back to is all the stuff that we can do to keep their core really strong. If the core is not strong and they're not strong to, hold themselves just in their own stature, which is the long back and then these little short legs, then we lose the core, then we're going to lose the framework that's going to, the skeleton and the framework of the back is going to start to bend, and we're going to put ourselves at more risk for having, a disc issue or some, form of pinched nerve at that point, we do not want to have. And that's kind of what we see in not only in this breed, but in others, but it's because the way they're designed, their framework is really not meant to be, as extra long as some of the dachshunds are becoming, and not as extra short-legged as some of the dachshunds are. And, genetics play a role in this, and who they are is who they are. And really, we have to formulate the exercise routine, not really tiring them out too much, understanding their little legs are going 4 times more than we are on a walk and so forth. So not over-fatiguing them and really trying to omit the jumping and stair climbing, especially if we live on a second floor.
You said something about stabilizing or strengthening their core. Now, is that a little bit like our own core? Is that kind of what you're implying? We need to do some kind of core exercises?
Yeah, it would be, so yeah, exactly. Very good question. That their core, so how would we stabilize their core is what we're going to say.
Yeah.
And really creating any type of, situation where they have to stabilize their body to balance. And that would be, we hear a lot about peanuts and physio discs and physio ball work and things like that. And you think about, well, we don't want to necessarily put the dachshund, this little dog, on top of a big ball. But if you were to stabilize that ball and allow them to stand on it, the amount of energy that they need in order to balance there, even if it's just for a minute, 5 seconds, is stimulating their core strength, okay? So by making their footing a little unsteady, we could do this by putting an air mattress on the floor and letting some of the air out and saying, okay, Pop, let's come across this air mattress so we're not falling a long distance, right? I always get into this when it comes to this physio ball stuff. It's like, some of the dogs aren't designed and built to be on this if somebody loses their balance. And what if it's us? They lose their balance. So I take it to the next level, which is the air mattress, a foam pad, an extra layer of comforter that you can do. And again, I'm going to kind of reiterate that I do a lot of home programs. And so instead of saying, oh, geez, go find your local physiotherapy center for dogs or your rehab center, I'm going to really say, what can we do at home to justify making this work? So that's where, just kind of creating a destabilizing environment. They have balance boards that are really low to the ground. The things that we use for ourselves as human, balance discs that are half rounds on the ground, putting them on there, even if it's just getting them to hold that for 5 seconds, they're using core muscles. And then what we try to do is get them to balance longer and hold that stance so that they can learn how to, engage those core muscles. The other side of this is also creating a program of what we call sit stands. And you'll hear and see a lot of things written down, or a lot of rehab therapists say, well, do your canine, your doggy sit and stand. The sit stand, when done correctly, and I have to reiterate, when done correctly, that they go into a nice square sit and they come into a stance where their nose never goes up and looks up at the owner. The nose has to come forward and look straight across. So you really have to get down on their level to do this correctly. They are in their core. And what we're doing when we do a correct sit stand is we're controlling center of gravity. When we control the center of gravity for balance, we're actually strengthening the core.
Oh, and those are really easy exercises that someone can do at home all the time. Thank you. That's first time I've ever heard that.
Yeah, very, very simple things to be done at home that multiple times a day versus even just a few, 5 or 6 a day, makes a world of difference.
You could do it every time you feed them.
Yes, exactly. Yep, exactly.
Speaking of feeding,
and don't get me wrong. I mean, there's plenty of other things that we can start to add to this, and lists that go on and on. Some of the ones, that really, more simplify it. Put the comforter down, have them walk across it, have them walk across the dog bed multiple times for the treat. But the sit stand really helps them start to control that. And then you can add the sit stand to a platform that's a little unbalanced, and you, what I say, up the ante, make it a little more difficult, but yet keep the exercises the same for consistency.
That's really interesting. Thank you. When we were talking about weight, I've read some of your work, and it was saying that you suggested, keeping a little bit of weight on dogs because it's better from a strengthening perspective. But we all know with dachsies, we want to keep our weight issue down because we don't want to have them be heavy on those long backs. So how would someone know how lean that they should keep their dog? Like, how do they tell if their dog is really at about the right weight?
Very good question. And since I'm glad I can tell you read what's in my website, because that is exactly the pinpoint is we hear lean. We got to stay lean. Well, at some point, lean also becomes too lean. And the ways that I describe this is that, the structure of the dog from the rib cage, their shoulders, their shoulder blades, or what they call the outer shoulder, and their hips, or their wings of pelvis, is their structure, at which that's like their most leanest point. So if you have a dog that, is with the rib cage and the ribs are slightly showing, you're actually not quite over the point of where I'd like them to be. That may be, and I'm not going to, create anything that's, another political change and hard to, controversies, but sometimes I find the vets wanting them a little too lean where the ribs are showing, and it doesn't give a buffer for something to go wrong. And when I say that, I mean, say they get sick, something happens, and what we do is we end up losing a little bit of body weight. Well, that's when we can start getting into problems. So I always like the dogs to have a little extra background, a little extra buff, so that if something goes wrong and they hurt themselves, we have something to go back on in the muscle tissue so that we don't necessarily start burning muscle tissue, in the fat tissue, that we don't start burning muscle for energy. With that being said, when we're too lean, we don't have enough of a cushion. So say they do the tumble down the stairs, or they are wanting to be Evel Knievel and jump off jump off the couch onto the floor. There's nothing that's absorbing the concussiveness of that exercise or activity. And then as time goes on, if that's activity that they're happening and having more often, then we will find that too lean is not going to be of justice. So I find that if you can put your hands on the rib cage and know that you really have to look for the ribs, that's really where I want them to be. That's going to tell me that the muscle tissue in the shoulders, on the lateral edges of the shoulder and the lateral edges of their hind end or their haunches, is going to be fulfilled. It means that once that layer is going on to the rib cage, that means that the body fat has met its mark and that the muscles are infiltrated with enough body fat so that they're holding what I would say 100% performance. Now you look at, as the dogs are aging, they say, as they get older, we want to get the weight off. Well, as you get older, the muscles start to atrophy. If muscles are atrophying because we're aging, we want fat to infiltrate the muscles so that we can keep the fibers as active as possible. And I'm going to give you an example, and I apologize for anybody that may be a vegetarian and not want to talk about meat. However, if you've been in the supermarket and you do shop for your own, or you want to walk by it and not look at it, we want to see meat that we eat lean. We don't want to eat that level of fat. So we see that we have a nice red piece of meat. When that animal has been kept for market, when we have a piece of meat that's got a little bit more fat on it, we tend to walk away from it because we don't want to eat it. But yet that's the marbled look that I would want the dog to feel in their body. When I put my hands on them and I feel the muscle quality, I want to feel that marbled fat throughout the muscles, so that as they age, there's room for, as the muscles atrophy, the fat infiltrates and keeps the fibers as active as possible. And that's the best, most simplest way that I can explain that. Because if we don't, we won't have a core, to fall back on, and we won't have the core strength and muscle to hold the back up, right?
Yeah, exactly.
So it can be twofold in one way, or in the other way, we keep them too lean. We're too concussive into the joints, and then we end up with a lot more of arthritic change and poor joint performance. That's going to give us the other side.
I think you just explained it. This is what you meant when I saw weight maintenance is the balance between muscular strength and fat reserve. That's kind of what we just discussed. So that makes sense.
Yes.
Yeah.
Yes. When they say muscle weighs more than fat, it's true.
Yeah.
It's true. And so we can have an overweight dog go into a program of exercise to lose weight, and they actually gain because muscle weighs more than fat. Is it interesting? Are you hearing? You know what I mean?
Absolutely.
So when we go into a weight loss program,
just like ourselves,
are we really losing weight, or are we just exchanging fat for muscle?
One of our biggest fears, obviously, is IVDD, and we were somewhat introduced through Leslie from Eddie's Wheels, and I know you do a little bit of work with dogs with back issues, and can you maybe walk us through a little bit, and I realize all dogs are individual, but through a little bit of an evaluation with a dog that comes in that is showing signs of IVDD and has maybe been referred to you from their vet, what the standard protocol is kind of as an introduction into rehab for them.
You mentioned Eddie's Wheels and in the whole process of, the dachshunds. It's like we kind of, in my world, because I work with rehab all the time, when I see a dachshund, I see the future of a wheelchair and all the devices that we've been able to have to help them continue to live a good quality life. And then I hear you say, I've had dachsies my entire life, and I've never, had a problem.
We had one. My mom had one years ago, and this was over 25 years ago, before any of this kind of rehab was really all that accessible. And we actually had a breeder that I had got two of my dogs from. They rehabbed my mom's Standard in their home bath and brought her back from complete paralysis in her back end and having to be expressed. She was walking in 2 months and never had another issue. So we did have one incident with my mom's dog years ago, but me personally, I've had 5 in my history, and none of them have had any issue.
The IVDD in looking at what is IVDD, it's intervertebral disc disease. And it definitely can be in something that's in process. It can be a condition genetically that they're predisposed to, that their joint and their ligament tissues, their soft tissues are not strong enough, and therefore the disease part of this is progressive. Or we can have it where we get an IVDD because of, too prolonged concussive nature things. When I see dogs and they come in, and the term IVDD is kind of like, oh, we have a dachshund with a bad back, and it must be IVDD. Off you go. We get the MRIs to conclude these things. Sometimes we have the x-ray, sometimes we don't. But we're looking at, either A, an acute paralysis has happened, or B, there's pain or no pain. And so when I look at a dog going into this kind of perspective that says, okay, this is what's happened, how did it happen, and how long has it been going on for? In the sense of, are we wobbly and weak and going into the point where we could be paralyzed? Or are we walking today and turn the corner on the walk, and now I had to carry him home? Okay. And all of that is the most important part of when we start to look at assessing or evaluating a dog that I look at is very important, because the longer there's been a problem occurring, the more muscle memory, the more history in the data bank, right, of what I call bad data has been being fed to their feet. And therefore it tells me how deep the rut is that I'm going to have to help them out of. And of course, how acute it might be. So when we look at Eddie's Wheels and we think of a wheelchair option, I really try to strive to tell people all the time that it's not a last resort. Some people think, oh, I don't want the wheelchair. My dog can still walk. They don't need a wheelchair. It's really not about can they still walk. It's do we want to keep them walking? The chair and the wheelchair devices, especially those designed by Eddie's Wheels, where it's a custom manufactured, unit, are designed to keep the body in healthy stance. which means the back is now flat, the body is now supported, almost as if they're walking in the water where they have buoyancy factor. That cart has been designed to give them a buoyancy factor in which their muscles can now meet the demand of their body weight in order to succeed the movement. If we can utilize these chairs, I say go for it. If we have access, get it done before they end up paralyzed, because you could really avoid that paralysis by allowing the body to heal in its natural stance. And how do we know this? Is because we've had dogs that have been paralyzed acutely that have actually rehabbed themselves back again. And sometimes all they've done is use the wheelchair. And so it's amazing to me how I can say I have 20 years of history and how canine rehab has evolved and not evolved, and has evolved in all of the things of water therapy and all the stuff that we have. But I really work with people where that facility is out of reach. And we still have the great successes of getting the job done and completed with the home programs, because we go back to the simplicities of keeping the body in a natural, healthy stance, allowing things to heal, and giving the body its feedback. Simple reflex, giving them a trigger in the reflex. We pinch their toes. They respond. Sometimes we think it's cute as puppies. We tickle their feet. They kick out. Well, sometimes that's a part of rehab, too. And when we go back to that, we want to see that we get, muscle function and all that. So I utilize Eddie's wheels. I utilize wheelchairs as a part of the therapy, even if the dogs are already still walking or if they're paralyzed, and it becomes a part of their daily regime program in order to either A, walk out of their carts, or B, allow that cart to be the best in motion and give them the best movement they can going forward. And that leads, into all other things, again, as to what, how far can we go? I have dogs in wheelchairs that have been in them for 2 or 3 years that are still standing and walking without them, but we use them so that they can continue to stay good and not go backwards. I have a dachshund that was referred to me, it was a year ago in June. He was 12 years old. The owners were presented with their primary vet, went to the primary, they were open, went to the primary vet, and they said, you really should euthanize this dog. He's 12 years old, and he's not going to get better. And surgery is not an option for him because of his age. And they didn't want to hear that, and they went up and ended up at Eddie's Wheels, and they got a wheelchair. They followed the protocol of the wheelchair. They followed their advice. They called me. I was on vacation. He called me. I had to answer finally. I said, all right, I'm on vacation, but I'll take the call. And I started working with him. And Toby, the 12-year-old dachshund that the veterinarian said, just put him to sleep. There's no hope for this dog. Today, by December, by Christmas, was walking out of his wheels. And to this day, a year later, he looks better than ever. He's now 13 and a half and still going strong. Again, what we have and keeping it simple, keeping the body platform where it needs to be, keeping the back, the top line good, allowing their core strength to come back up, and really keeping the rest of the health tissues good. And I look at other things as well as how does the muscles feel, what is the tonus of that muscle. Sometimes I get a lot of, referrals, and the dogs are actually low thyroid. And if a dog is low thyroid, they really weaken their system. And so I have to work with the wellness vets to kind of get a little bit more back on track with that sometimes can be missed because they are a dachshund or they are a corgi and they have a funny back and you expect them to have some wonkiness. I don't like that. And I always go back to some of the more basic things that get missed. And sometimes that's a low thyroid. So we do a lot of wellness care and a lot of nutrition supplement therapy too. But it's still, we've been able to create these programs that allow dogs like your mom's dog that way back when, before rehab was even really thought of, they kind of just did their own thing and it worked. And it's true. It's really not as difficult and it's not as out of reach for some people. And I'm going to say out of reach might be because out of reach is that they physically can't get there. I can't drive my own dog there. Or out of reach financially. I don't have that. I'm limited and I don't have that ability. Or out of reach can also be that there really just isn't anything located near me, and it's going to take me 6 hours to get there. So again, there's options for everybody, and I will always want to refer into a center, but we can also create home programs that are for maintenance, preventive care, as well as the rehab side of things.
Wow, that's really optimistic. Quite often we do hear that dogs are euthanized because of exactly what you just said. Their only option was something that is possibly out of their reach, and that there weren't other options given to maybe help get that dog back up and walking or having a good quality of life. So hearing that is, I'm sure, will help a lot of people make some decisions down the line. So I really appreciate that. For me, that's a very powerful thing, because a lot of people they just can't afford one surgery, or like you said, a distance. If they're living in small towns, they may not have a place such as yours that they could go to. So being able to access this from a different way is really, really important. Thank you for that. I think we kind of touched on this a little bit, but obviously working with a dog that has something that's just happened, probably a little bit easier than working with one that's had an issue for a long term. That's not the best way to approach that question, but easily you're going to get a better result working with rehab with a dog that's just had this gone down with an IVDD diagnosis that's just happened, as opposed to one that's been going on for a long time.
Yes, and I think that just helps you to understand, what things could have been missed that were leading up to this, that were still a part of it, versus understanding where yesterday we were walking and today we weren't. I think knowing the history of the last 6 months, the last year, is more valuable, because if it had been happening back then in some way, we can totally misunderstand that. They think, well, it just happened, so we're going to go in for surgery and we should be great. And sometimes, they come out and that's not, that the end result isn't the same, because they think it was a 24-hour injury, or 24 hours since injury, or 12 hours since injury. When reality is that dog's just been kind of compensating and maintaining herself as good as they can. And we really have a deeper time frame, a longer time frame than what we're suspecting. So yes, and then there's a lot of things too, like in a young dog, that we can do. I mean, when I really go into the depths of what I do and work with the body's fascia in muscle tissue, we talk about muscle tissue, and we talk about tendons and the discs that are involved in supporting the spine. But really, the dog is covered in fur and skin, and that skin is really called fascia. And the body is layers and layers of fascia that makes all of our body parts work and move. So I go into the depths of that fascia and really teaching my clients, how to read their dog, to interpret if we have anything presenting that could be compressing on the spine, or that could be leading up to shutting down the body. And that's because the fascia is going to read any type of referred pain pattern, and it's going to redirect you to the pull. So if we have a bad hip, the fascia is going to direct me, as it's tugging of warring throughout the body, is going to bring me to that hip. If it's a cervical problem in the neck, a problem in the cervical spine up in the neck region, the fascia is going to basically draw me towards the neck, right? So if I have a certain way I want to move that fascia, I'm going to read the body. And so what I do is teach clients how to better understand their dog. And I say pet them in a new way. They're going to do a type of massage called purposeful petting. And it's the greatest thing ever to sit with your dog and be able to purposely pet them versus just pet them. Gives them a read as to who they are and how they feel on a good day. And when they start doing that more routinely, when something starts to go wrong, or there's a tight area, they're compensating for something, they're going to feel it, because that tissue is going to feel heavier because it's not the way it normally felt. And so I really teach and guide my clients to how to, if I sit down with somebody and I really want them to take something home with them today, and their dog is healthy, it's going to be getting the fascia, reading the tissues, and doing your core exercises. Because two important points is if we can keep the core strong, we're good. And as long as we can keep the tissues open and moving, they won't lock down and then put pressure onto the spine.
How does one do purposeful petting?
Purposeful petting is so instead of, we talk about petting the dog, we always go with the hair coat maybe start at the top of the head and neck, and we pet down their back and down their body. Some people just might kind of scratch behind the ears or kind of rub their shoulders, and that's where they end. The purposeful petting side of this is that we would start at the back of the neck and head and earn their trust to touch them. And then what you would do is simply squeeze the fascia, squeeze the fur. So say we have a long-haired dachshund. They would have longer hair that kind of filters through your fingertips a little bit.
Yep.
And you can kind of use that and squeeze it. So we do little squeeze techniques through the hair coat. If they're short-haired, then we'll actually pinch the skin in our fingers so that we can lift it off the body and allow our fingers to touch with the cushion of the fascia between them.
Okay.
And then what we do is we lift up and move it, what I call, we can say north, south, east, west. We can say up, down, right, left, whichever direction of what they call compassing or clocking that we can map right down the dog from the head, back of the head, all the way to the tail. Lifting each piece in our fingertips, it should lift equally from the back of the head to the tail. If it doesn't lift equally, it's going to feel like a suction cup. And where it's kind of suctioned, when you start to lift, they're going to look at you. Some might cry out if you do it too hard, too fast. They'll cry out with a little discomfort. We just go back and ease that up a little bit, and we ask them to soften their touch and to not lift as high, and maybe just roll the tissues. So just roll the fascia, roll the skin from the right of the spine to the left of the spine. Everything that I do with the dog starts at the spine, at the head to the tail, and then goes to the right of the spine and the left of the spine. If you can move the fascia on the dog on those three planes, you've definitely worked the entire circumference of the animal, because if you can take the skin on the right side of the spine and bring it to the left side of the spine, and vice versa, from the left to the right, along the entire spine, you have rotated the fascia along the dog's body all the way from its belly to its back. And we can actually work the entire dog by just purposely petting their back while they're laying with you on the couch.
That would be almost the equivalent of foam rolling when we use a foam roller. We're working.
Exactly. Yes. Yep. Yep. But we have to be able to, can we tell them how to do the foam roll? Like, we will do it because we feel it on our bodies, but we can't teach it to them. So yes, in some way, this is a technique of foam rolling.
Well, that's really interesting. We did this, you mentioned it when we kind of grazed over it, but I'll come back to, you said you were trained in Trigger Point Myotherapy. Now, I hadn't heard of this before. Could you maybe explain what that is and how we can, or how you use it to work with the dachshunds?
Well, it is a more formality type of massage. Okay. And to really say that, you would use it without the proper training. It's really, when we find areas, so trigger points aren't like acupuncture points or acupressure points that are already designated, right? Like those kind of charts in Chinese medicine and meridian charts are already designated areas. Trigger points are areas in the muscle tissue that what we would say are insulted. They've been hurt, injured, or are harboring tension for some reason. And our job as a therapist that's trained in trigger point myotherapy is to map out the body, whether that body be human, horse, or hound, in this case, the dachshund. We would be trained to actually map out all of the imperfections in these muscle fibers. And so I'm trained to know how the muscles are, which direction the fibers run, how those fibers operate, where they live, they lie, is how they work. I'm trained to know all of that. And so when I feel that there's little speed bumps in my way, I'm going to learn. I then have the techniques in my bag to then work through that, through all the different massage techniques, to see if we can smooth out those wrinkles, get rid of those speed bumps. So to answer your question directly, can I give that to somebody? No, I can't. I can't give them a training that I formally took. Or a certification that I formally made for myself, just as I can't give somebody a DVM and I can't give them a doctorate. But what we can do is learn simple things that simplify it, just like the technique I mentioned of purposeful petting and different types of massage to kind of help with these things. The best way that I've come up with working with a person, an owner, who doesn't have a history or a background in medicine or therapeutics, is to learn how to read the way it pulls and the way in the way the tension opposes you or not in the fascia. And that alone has been able to, I say, unlock some things where they've actually been given tools to do the job without necessarily being formally certified.
Great. Sorry, I didn't mean to imply that you would show that to somebody. I just meant how you would use it. I'm like, I knew.
I'm so sorry.
That's okay. I was like,
so
oh,
sorry.
no. That's way beyond our bag of tricks. Yeah. I wanted to.
But there's I mean, how I would use it is great. I mean, I could tell you all about it. But I really have a passion, and I think you keep hearing me go back to that passion is what can I give you to help your dog?
I see.
Because you can't come to me as many times to benefit, and I necessarily can't get to you that many times either.
Yeah.
So I'm going to let everybody walk away with what they can use with their own dog in order to make a difference and be really thankful and appreciative of what they've learned and the knowledge so that they can, understand in their animal in a new way.
One of the other things is if we have a dachshund that comes in that is in a cart already, is there something that you would also focus on to help make sure that the parts that are working don't get overworked? Exactly.
And that's, when we want to say cart, or do we want to say Eddie's wheels cart?
Okay. Sure.
I will speak different languages on that because the best way is that if they're in a cart, we want to make sure that the cart is well balanced and that the animal is as balanced as normal can be.
Okay.
With their disability. I always call my friends specially abled friends because that's what we want is they don't know that they can't walk the normal way. Yep. They're walking their way. But when only the front end is working and the hind end is paralyzed, as long as what is carrying them in a balanced fashion, there's not going to be the extra load that there would be if those legs weren't working per se. What we have to understand is that if they're being carried in the balanced way, whether the front legs are working or the rear legs are working, so sometimes we have front leg issues, as well as the rear, those legs aren't doing anything different than they normally would be doing if they were walking. It's interesting, and it's hard for some people to fathom, but what we want to make sure is that they're not having any extra load or pressures in other places than they normally would if they had a normal functioning body. And so we watch especially for areas in the shoulder, and that their shoulders don't necessarily get drawn back because their center of gravity is too far forward, or their center of gravity is too far back, and their hind end is getting kind of pushed down, and they would end up with a little bit of what we call like a lumbar sciatica, low back pain from that. Some carts are perpetuating issues for an animal that already has a perpetuating problem, and therefore we have to kind of pay more attention to the areas that are working. But I look at it a little differently and say, I go back to let's find a way to fix what is perpetuating it in a negative way and offload that area. So I work very closely with Eddie's Wheels for the purpose that they are local to me, but they are a superior product that are reachable. And some of those things is because they're able to change the way the dog is loading the body of the working parts. When we can't do that, then we will need more and more body work and care going forward for regular maintenance. And so we just want to look at movement as a flowing movement, not as a lugging, thugging movement. We want to make sure that the cart is being towed with its ability to follow, not make them travel a different way because they're carrying the cart. I have little dogs and big dogs. I've had dogs that were 5 pounds, 4 pounds in carts, as well as dogs that have been 105 pounds or 150 pounds in carts. And it all operates through the biomechanics. We can offer different types of massage for all the different muscles as a maintenance. If we would go to massage and have a massage every week for our bodies, we would feel amazing because we constantly are adding to this perpetuating life of inconsistencies. But when it really comes to our animals, I find that the clients and my families are really willing to create as much constant as we can for them, because consistency is best for them and how their care is going to be managed. And once we do that and that balance is had, the dogs just really thrive well. I hope I answered your question. Again, it's not as straightforward, I think, as you were thinking it was. It definitely goes a long ways when you look at, we have different options and there's different levels of affordability for different reasons, but every option is available, and don't let something get in the way of determining what's best for their pet.
Oh, that's great. You answered that question perfectly. Basically, if you're working with something that's working with the dog, then it's a little bit easier to manage. And if you're working something that's working against them, then you might have to work a little
why
harder.
couldn't you have said it for me? Why couldn't you have said that for me?
Yours was much more mechanical, and it totally makes sense. And when you think about it, like, people don't realize it, and you certainly wouldn't realize it as a pet owner who has no background in terms of any kind of rehab or working with a dog that's had any kind of issues. So, you just think that you're doing the right thing and you get something, but it's not maybe the right fit or the right product for that particular dog. They've already spent the money, so you have to kind of work with what they have. But so I get really doing the right research before you put your dog into something like that will save you money in the long run and your dog's health.
Absolutely.
Awesome.
You got it. This
is very informative for so many people. It's so overwhelming when they have a dog that runs into this kind of a problem, and everybody's throwing them, various, what worked for their dog and what worked for that dog. And as you said, it's really very individual, but these are some really good points that people can pick out to help them make these really important decisions at a time when your head is and your heart are kind of fighting each other. So I really appreciate what you've been able to give us so far. So the one other thing that I saw that I was really interested in was your program that you call The Power of Three. If you could maybe just tell us a little bit about that. That sounds like a really interesting program.
The Power of Three, and if you look into the depths of that involves actually another, one of my coworkers. Her name is Kelly Rosado. She does energy work. And so we're familiar with Reiki. Reiki is a term that we're often using. She also does Reiki to a more in-depth level, an intuitive level in what they call theta, which is actually going in and really helping our animals not hold on to their past that may have been an injury or something that they're holding on to from anxiety, stuff that they can harbor in them as we harbor in people from birth. The pups do the same thing, and the horses, the animals. So the Power of Three is a unique thing that we've come in to create, that we learned by working with each other, to really find that when we incorporated Kelly's energy work and my massage work in the same time frame, so the same session, with the animal, I'm one energy, Kelly's the other energy, and the animal is the third. There's the Power of Three. We were able to unwind tissues. I'm able to feel releases happen in these body tissues faster than I can achieve in one session alone. Kelly, has been able to really understand and justify how the energy is being fed in the body by how I'm interpreting the tensions and being able to speak that. And so she's actually able to flow it. So I'll say, geez, okay, I'm locking up here in the shoulder, back at at L1 and thoracic 4. I have this held. I now need energy put through, thoracic, we call the lumbar spine, TL junction, to the sacrum. And so what we'll do is I'll energetically work, she'll energetically work, kind of getting through these roadblocks of energy flow. That's going into a whole other realm of therapy work, but it is still part of rehab. And we unlock these animals in the way they smile at us and the way they look at their owners and the way the owners interpret how they're doing at home after is remarkable to just something that I've, in my history of work, couldn't really compare. I would have to see that animal 3-4 times before I could get that type of power out of us. And it's really cool. And I do a lot of laser therapy as well in my practice if I'm able to put our hands on the dog. The energy work and some of the theta work that Kelly does not necessarily have to be present with the animal, just as I don't have to be present to do some of the work that I do because I work with the owners through their hands. So we do, video consults, my eyes, the vet's perspective, history, my eyes, the owner's hands. We can also do the same thing with Kelly. So the Power of Three is something that we've created from our working together, inspirationally, what we've felt, what the owners have fed back to us. And it's actually, really leaves us at the end of the day feeling, pretty phenomenal, because it's just an intuitive thing. Healing is intuitive. It's people say, how did you learn to do what you do? And I say, I really didn't learn it. I just found out who I was through my healing work. It's been in me to do what I do, and it's not for everybody. So that's where the power of 3 came from.
I really like that. I actually am a Reiki master as well. So when I read through that,
that's great.
Yeah, I was like, that's such an amazing way to do it, to work together in a situation like that. Thank you for creating that. And so I'm sure there's a lot of happy hounds out there that are thrilled with the two of you came together to make it work. Now, also, as we've been talking, you've mentioned a couple of times about working with clients at home. Now, you also offer an online option for your clients so that if they don't live near you, they can still work with you. Maybe you could explain that so that if anybody out there is looking at getting involved with you, they'd figure out how to do that.
We created some online work, have online consults. And when it first came out, it really started as I might have been doing a checkup on client that somebody else had already worked with, that really they couldn't get through something. So I was looking at movement, right? I kept going in and looking at movement through these videos. And as technology has evolved, so has the world of what we can offer. And those chats that I had with technology, looking at movement, allowed me to be like, okay, I see something, and if you really quickly just do this and this as an owner, you're going to fix this and don't worry about it, right? Mm-hmm. And so it just started to be like, wow, I was able to help them work with that. And now they're like, wow, that made a huge difference. And oh my gosh, I can't believe this. I said, well, you're going to walk them that way for this, and get back to me in a week. And they're just like, well, they get back to me, and it's amazing. So I created the online consults to work with somebody just as if they were one-on-one with me here. And again, I work through the veterinarian's work, their blood work, whatever the history from the veterinarian has been, so that I know exactly where this dog is from their perspective, from the veterinary side. I then allow the owners to present to me the dog in the best forms of communication possible. And I teach them how to start range of motion, to do basic stuff, whether they've had knee surgery, back surgery, whatever. I teach them that. I teach them the purposeful petting techniques. I watch them go through their dog, and I evaluate how the tissues are moving through their hands. And I help them actually unlock these tissues, not, again, certifying them or training them, but working with their dog to do this so that they can have the benefits of getting their dog back on track. Again, it offers an affordable option for people. It offers it to people where it's out of reach. It started that way. And now I even have sessions with my neighbors down the street when it's 12 o'clock at night and they have something to ask me. And I say, well, let's just jump online and get this done, because I'm not driving down the road at midnight. So it's been a very unique change for me. I has really I've understood more of my passion through this, and really how much I understand. It's given me great options to work with all of the clients that I can. And I say, not just here and locally, but worldwide. And has really been able to, for people that find me through word of mouth, somebody knows somebody somewhere. And next thing you know, they're calling me from China. I'm getting calls from Japan and Australia. It's been ever evolving, and I can't imagine where I would be without it today, other than, I'd only be able to work with my local people.
Well, hopefully people will hear this podcast, and you'll get some other people that will give you a call in hopes that they can help work on their little dachsie as well.
Absolutely. And it's been also just basic maintenance stuff too, teaching them the proper sit-stand technique, teaching people the way to do, different maintenance things, not always the rehab. Started off that way, but now we're evolving, working with people that have treadmills and they want to do more exercise programs. We'll work with them to do that as well, talk them through all of it as if they have like their own canine coach right there.
We've only, just scratched the surface of canine rehab. But is there something that we didn't discuss that you think maybe a dachshund owner should maybe be aware of or be doing as a preventative?
I think some of the things, we touched about weight and body weight and management, things like that. I really kind of have to say, whether you're a dachshund owner or any animal owner, diet and nutrition plays a really big part in how healthy the body stays and how healthy they're managed. Not even if it's just from weight gain or how we're holding weight, but really how we're feeding the dogs. Sometimes, again, what we do kind of goes all the way back to some wellness stuff and back to some basics of, well, let's make a change in some foods that can really, stop allowing the body to go in this negative direction. And some of the other things are that, when you're really close to your pet, they sometimes become a product of us. And I do work a lot with people in their dogs where I really don't feel like the problems in the dogs are theirs. They're trying to take it from their owner because the owner has a low back or a bad spine or a bad shoulder or a bad knee, hip. I find that the dogs, especially our dachshunds, our smaller breeds that really sit with us, and our lap dogs really they take this on. And I think it's really important to understand the health of ourselves and that we're not feeding some of this energy into them and allowing them the chance to know that they don't have to take it on for us either.
That's a really good point. If people want to reach out for you to get some more information, where should they do that?
We are available to be reached at changeyourrange.com. It's all three words right together, changeyourrange.com. We also have a Facebook page, and I encourage you to check it out and like our Facebook page and look at some of the things that we do with that, and that's going to be Change Your Range on Facebook. You can always email, and email sometimes becomes one of the greater options of starting communication, but it's changeyourrange@gmail.com. And I think that's that way there you'll get all the information on how to reach me direct by phone or not. But I think opening conversations through email or Messenger on a Facebook app would be perfectly welcomed.
My last couple of questions. I'm a very avid reader, and I always like to ask my guests if they have any kind of a recommendation for a favorite book that might be a good reference for pet owners, whether it's a natural book about natural pet care or therapies or even massage, or just a really nice little reference book that they could read through.
Yes, and I do actually, and I have a book that I have found. So part of my career path now has been since the late 90s. The book that I refer to a lot and I love is by Wendy Vollard. It's called Holistic Guide for a Healthy Dog. She does have two editions. The one I refer to a lot is the second edition, but it really, it was written by Wendy Vollard and Carrie Brown, DVM, and he's basically, was the veterinarian that helped assist with this. And I really enjoy this book for the fact that it really spells out some basic, simple things. And again, I talk about how I go back to the basics and how I like to keep it simple as well. And I think it really talks about, like the nutrition and how to understand the nutrition and what the dog needs and, how to interpret some common, blood work things that your veterinarian would be doing should your dog be sick and what to expect when they talk with you, how to do some basic massage, how to do some basic testings. They talk about kinesiology, the theories of herbals and some homeopathic options that can be done. And importance of vitamins and minerals as well for things that can be done with the dog from a diet perspective. So, feeding your dog the most helpful foods, understanding vaccines and other protocols, and keeping your dog healthy throughout their life, with alternative therapies. And that would be my reference and my recommendation.
Perfect. I actually turned around as you said that. I have that book sitting on my bookshelf.
Yeah, that's wonderful. That's what I refer to it a lot for different things, and it's been a great guide for me, and it's a great question for you to ask. I'm so glad you did.
That's great. Our final question that I ask everybody is that we know that our dogs are amazing teachers, and what could you share with us that you've learned from either a client or a dog of your own?
I got to say that, I can I can speak fluently and answer questions to the best of my ability, and knowing that throughout my career, I can name dogs on top of my head and by name and by breed and exactly who they are. And, you know, some of them started my career. Some of them made me question my career. They've all challenged my career. But every single one of them has helped make me and give me the ability to help others. So I have learned from every one of them. There's definitely not one story other than they've each had been created. We've been able to, and I say we, the teams, the veterinary teams, the owners, and myself have been able to create healthy programs that work for everybody. And that's the best I can answer that. That was a really, powerful question. It definitely bring tears to my eyes to even start to think about some of those stories. But they have all taught me something, and never give up. The impossible is possible. And don't give up, because there's hope. And if it's not what the answer that you thought, they're going to help give you the answer that's right. And that sometimes is just being happy, no matter what form of ability we have. It's just learning to accept it and live on.
Thank you. You can truly hear the passion in your voice. I really appreciate that.
Thank you so much. I mean, this has just been a great opportunity.
Thank you so much, Ericka. I really enjoyed this conversation with Ericka. I have 3 dachsies, and I'm going to implement the purposeful petting and the up and downs for sure. If you're interested in working with Ericka, give her a message. I'm sure she would love to hear your feedback or work with you and your dachshund. Next Sunday is my birthday episode. Keep checking on social media over the next week for a few hints on who our special guest is. If you have a wiener dog story, an event, or a topic you'd like to see us cover, send an email, bark@wienerdoglover.com. Follow us on Instagram, wiener_dog_lover_, or Twitter @lovingwienerdog, or find us on Facebook, Wiener Dog Lover. Never miss an episode. Head on over to wherever you listen to podcasts and subscribe, and you'll be notified every time we put out a new podcast. I'd also be grateful if you would leave us a review. Until next time, Wiener Dog Lovers, this is Lori, Sheba, and the Wieners signing off.